Hi everyone, this is journal entry number 10 for MN668. Today I'm just going to address a few questions in my last and final journal entry for this course. The first question is, what goals did you set for yourself at the beginning of the semester and did you meet these? So the goals I set for myself were to increase my critical thinking skills, to look at not only the disease processes, looking at how they work within, the individual care plan, and also looking at understanding proper medications based on the correct disease. So I do believe that I increased those skills and I strengthened them during the semester. Now I do think that there's always, room for improvement because everything is in evidence-based research. So, things can change with medicine. But I do believe that I did increase and strengthen those skills. The second question is, what feelings, prejudice, and bias did you experience during your clinical experience and how did you manage them? To be honest with you, I do believe that I went in with an open mind and trying to not be judgmental and trying not to have any preconceived notions. While, some patients, I didn't understand like why they were going through what they were going through, or not necessarily with patients that were going through like depression, anxiety, just normal things like that, but addiction. Like some patients, very much, it just seemed like they had just given up and that's what they wanted to do. And I had to, really, I'm not going to say tone it down because you listen to everyone's story and everyone has a reason of how it happened. But some, it just, you have to not be judgmental. And I've always learned, not to be that, but and it was only a few patients like that. So I really did, kind of, bring it back, listen to everyone's story, listen to or understand their history as to why, whether it's, family dependency issues that, they were saw as a young child, whether, alcoholism, things like that, that can really trigger it, or, being around the wrong crowd. So, just understanding that. And I think I did a pretty good job with not showing any prejudgment or prejudice or bias. The next question is, how did you manage your anxiety, self-doubt, and uncertainty? Well, in the beginning, I will say that I was very anxious because my preceptor throughout the whole semester was like, what is your care plan? What do you think would be the correct medication for this patient? And I did have a lot of anxiety with that because I'm like, oh my gosh, I've learned about these, we're going through these this semester, but now I really got to put it into practice. So that was my biggest angst during the semester, but I feel like I did get through it. I became more comfortable as the semester went on. And just with, knowing what disease processes, age ranges, looking at the actual medications, dosages, what to expect. Also looking at, and my biggest thing is, what if they have like, side effects? What if they're not supposed to be given X, Y, and Z, and they're, the one patient who has like a heart condition or something that where they shouldn't be having that medication. So those are my biggest anxiety points, but I do believe that I did work through them as the semester went on. The next question is, what understanding or insights did you develop during your clinical experience? So I will say that just overall, I had an array of patients. So from patients with anorexia nervosa, alcoholism, basic depression, anxiety patients, schizophrenic patients. So I was exposed to a large range of patients, and I will say that this did definitely increase my experience and my knowledge of how to treat these patients, what characteristics to look for, and treatment plans. Has reflective practice impacted you as a person, student, and or provider? If so, how? I believe it has, because it's given me the ability just to reflect weekly on, what could I have done better? How can I be of better service or of better help to patients? And also, to anyone that wants, my services, or, anyone that just asks, like, hey, can you listen? Or, so just looking at how can I, have a better practice, be a better practitioner. I believe that being able to reflect on weekly journals has given me that ability. The next question: will you continue to use reflection in your future practice? I believe I will, especially for patients or cases in which, they might be new, might be something, I'm not used to, or just things where I might have those prejudices and biases, reflecting to see, did I give the best care? Did I, provide the best service for this patient? Was I the best that I could have been? I believe that it might not be every week, but I believe that it's something that I can use just to be an overall better provider. So better communicator, better person, I guess. All right. I hope you enjoyed my last and final journal for MN668. And that is it.